to talk about Lyme's disease in humans and dogs, and I have experience with both. I personally have had Lyme's disease twice, and it's horrendous. The first time that I got it, I had just gotten my dog Tonka, the GSP, super active puppy. You know, when he was a puppy, he'd just run out, you know, on the leash and get instant tension and stuff, like very hyperactive and active. And I remember being out there, I was out on Broadway, and I was thinking, my God, I feel like I'm 80 years old. How am I going to deal with this dog? You know? And I started thinking, I was like, man, I wonder if I picked up something from a tick. I went to the doctor and I had Lyme's disease. You know, you take the antibiotics and you start feeling better. This year, I got it again, and I'm just now getting over it. I've been on antibiotics for about 2.5 weeks, and I got it goose hunting, and I noticed that I had a tick on me, and I pulled it off. And I was honestly going to take antibiotics prophylactically. You know, I was going to take them because I'm like, if I have one on me, you know, those little ticks, if they bite you on the head, you're not going to see the target pattern. And supposedly the target pattern doesn't always show up anyway. So you can be tested for Lyme's and come up a false negative and actually have it. So know that too. You have to take antibiotics for a long time. It's not 7 days. And the reason why you have to take it for so long is that bacteria just kind of like hides. You know, you start taking antibiotics and it pushes it down, but it kind of like hides, and then it rears its ugly head again. So if you take it for a week, you're going to have it again. And honestly, each time I had it, including this time, I took antibiotics for a week, I felt great. And then about another week later, I started having sort of symptoms again. And so you have to keep taking the antibiotics. It tries rearing its ugly head. So know that if you have it, you're not going to know really what's going on. And the only reason why it dawned on me, it was like I was feeling like I was 85. Tiredness, you know, I was so tired. I would go work with the dog, and I'd come up and sit down, and I'd say to myself, my God, I feel exhausted. You know, I was having trouble doing my job. You know, but the worst part of it is you get like these flu-like symptoms first. I didn't think anything about it, you know. I was just like, oh, I'm sick or something. I didn't think, oh, Lyme's disease. It sort of goes away, and then, you know, it goes into a longer thing. So that was in September when I was probably bit. So you got October, and then November, it's like full on, and I'm having like this like really bad arthritis. I already have arthritis, so that's what I'm saying is if you already have arthritis, it's going to make it a lot worse. I'd get up. This is truth. I'd get up to go to the bathroom, you know, at night, and I'd be stumbling, I'd be like, I can't walk. Like, I'd be like, I'm going to fall down. I was losing power. I was having trouble walking. I was losing power. So if you have any of these symptoms and you go hunting or you go, you know, camping, stuff like that, go get checked for Lyme's disease. But remember, you might get a false negative. Make sure and tell the doctor, you know, bring up Lyme's disease. It's better to be on antibiotics for 30 days or whatever and get rid of it than it continuing, and it can cause central nervous problems too. So with your dog, the first thing that you might notice is that your dog is limping. And that's the way I've always noticed it, and my dogs haven't had it in years, but I did have a couple dogs that had it way back when. And that's the first thing that you notice. There was a loss of appetite. One of my dogs was shaking a whole lot, like shaking, didn't want to eat, and wouldn't put weight on the leg. And usually the leg that they don't want to put weight on is they're having arthritic pain, and that's where the tick bit them. So in most cases with canines, a dog can get bit and it not affect them. You know, you could check Lyme, Connecticut, where this all originated, and you could check dogs and see if they have, you know, titers for, you know, that bacteria, and a lot of the dogs will come up, you know, as having Lyme's disease, but they'll be asymptomatic. So keep that in mind. But some dogs get Lyme's, and they get it so bad that it causes their kidneys to shut down. So you don't want your dog to get it. Use flea and tick prevention. It works. 2 years ago, I was pheasant hunting with Tonka, this dog Jake, and my dog Ike, and I put flea and tick prevention on them before I went, And then as we were coming back from pheasant hunting, I looked in the crate pan in the car. You know, I have a crate in the car. There were dead ticks in there. So definitely that stuff works. You have to use some type of flea and tick prevention. And also, my dog Ike, because he comes from a line of Labradors that can't handle Lyme's disease, I was told by the breeder that's a vet, make sure and get the dog on the Lyme vaccine. You know, it is an option. And before the Lyme's vaccine, they weren't sure if it was working properly or if it was causing the dogs to have Lyme's disease, but they took it back into the laboratory and remade it, and now it's effective. So you have that option. You can always get the Lyme's vaccine for your dog. I don't think that they have a Lyme's vaccine for humans. I wish that they did, because now, you know, I've had it twice. It seems like every time I go goose hunting every year, I seem to be getting it. It's nasty.